Hi, I am Dr. Dharmesh Kapoor. I am a liver physician working at Yashoda Hospital, Secunderabad.
For social drinkers, is there any safe way to enjoy their alcohol without harming the liver?
Even if you were to just randomly Google any Hollywood party in 70s, आप करो Google, देखो आपको क्या दिखता है. Now, exercise is a very poor way of losing weight.
So, welcome to the program, Dr. Dharmesh sir, and it's a pleasure to have you always on the show.
Thank you so much.
So, I'm sure you would agree when I say our liver is a silent superhero who's working in the background and keeping us healthy and going. So, what are some secret jobs you think that it does to our health and our life every day?
So I think liver is what we call in a colloquial parlance the metabolic workhorse. So it functions throughout the day, even when we are asleep. That is the organ which is providing vital carbohydrate substrate so that our brain as well as those parts of the body which do not have an active ATP generation functioning, and that includes primarily our RBCs. So the red cells which are in circulation, they depend a lot on the glucose as their only substrate for generating energy. So this is a silent worker, like you rightly said. And when we are awake, then it is serving completely different functions. So it's storing energy for us, so that at night time when a human being is not being fed, at that time it can provide substrate to the other parts of other tissues and organs. And this is the era that we live in. We live in an obesogenic environment. There is a caloric explosion. So most of us actually eat more than what we ought to. And then the poor liver has to take care of those excess calories and store them as fat.
Do you think liver is really healthy when we say I can eat whatever I want and I can take whatever I can?
If one were to set this up in the correct perspective, oftentimes we think that someone has got a poor control, and that is why they will eat whatever comes in front of them. So we human beings have evolved from the hunter-gatherer humans, or whatever they were called, in the earlier eras. Even if you were to just randomly Google any Hollywood party in 70s, आप करो Google, देखो आपको क्या दिखता है. So you'll see all people like this. So how is it that in 35 years everybody has started to look this? So that is the science behind this. These are the times when there is actually a surfeit of food or nutrients that are available to us. So evolutionary, our mind is still wired to that era, but the requirement is not there. So that is why most of us still believe, and mind you, this is not a choice. Oftentimes we doctors are also guilty of this. You see an overweight person in front of you and you start blaming him that no, you made the wrong choices and that is why you are the way you are. But it's not all that simple. It is how we are wired. So it all gets taken care of at the level of the brain.
After listening to your talk, maybe I should go and run on the treadmill now, maybe.
Again, interesting. So we all believe that, if you eat right and you exercise regularly, you are going to be healthy. Now, like many of the other physiological aspects of human functioning, this is also not completely true. Of course, I am not saying even for a minute that you should not eat right, and I am not even saying for a minute that you should not exercise. You should be doing both of these two things. But this, in many instances, will not control the way you look, or it will not control your phenotype. So human beings, we have fat, and we think that fat is just a storage organ. That's not true. Fat is an extremely vital endocrine organ for us humans. So it releases certain chemicals. Those chemicals decide whether our brain is going to signal satiety or our brain is going to signal feed me. Now, exercise is a very poor way of losing weight. Oftentimes we don't realize that. So we think that if we exercise regularly, we will not put on weight. Now, if I have to tell you that you will need to run at a speed of 9 kilometers per hour for about 60 minutes to burn 500 calories.
500 calories, I guess most of us can eat it in 5 minutes.
Absolutely. So you just think how hard it is going to be able to achieve that. And how much do you need to burn to be able to lose 1 kilogram of weight? That is about 3,500 calories.
The math seems to be simple, but the biology isn't, I guess.
Absolutely.
So with this, I think it would be interesting to know what you eat in a day. I mean, I'm sure you don't have anything such as cheat meal or binge eating or guilty pleasures.
So again, so that brings us to the larger question of, what advice we should be giving our patients. So the simplest advice, which I have found extremely useful in my clinical practices, to do something which they will be able to sustain. So go on a hypocaloric diet, and which should be sustainable. Let your nutritionist have a very patient hearing with the patient or the subject. Many of these people actually who come to us are not patients. And then ask them what are their dietary preferences. So at the end of the day, what really matters is the sum total of what you have consumed. So if in a given meal you had a kind of a cheat meal or a cheat session of eating, then you must make up for that in the next meal. So that is how one should be looking at this whole picture.
So I think, Dr. Dharmesh, you look the same since so many years that I've known you. So what's the secret that you've been following?
So again, like many things, that is not the whole truth. So I am oftentimes told that I have lost weight. That might be true. I might have lost weight, but it's again a very important an offshoot of that statement is that when you lose weight, you just don't lose fat. You also lose muscle mass. This is again something that we doctors are guilty of not telling our patients. There is no way you can lose fat and fat alone. So there will always be some amount of muscle mass that you will lose along with the fat. We have to have a balanced diet. None of us leads a perfect life. So portion control is the most important thing, which I try to follow in my day-to-day routine. And of course, exercise. I sin when it comes to sleep. I have a sweet tooth. I take desserts every time after every meal, but portion control. So I can stop by just a bite full. Don't need to eat the whole bowl. So that is what has worked well for me over the years.
So talking about overweight, obesity, and all the junk food, fatty liver seems to be increasing among the young population especially. So how would you like to explain this to someone who doesn't understand science at all?
Two things here actually deserve a mention. A, that fatty liver is clear and present danger. There are now global epidemiological studies which have shown that at least about 1/4 of the human population in most parts of the world, they have some degree of fat in the liver. Now, the scientific definition of fatty liver is when more than 5% triglycerides are present in your hepatocytes or the liver cells. The main two problems that we are contending with as liver physicians are A, alcohol associated liver disease, and B, the steatotic liver disease. Now, when it comes to lifestyle modification, that advice should be given to every single person, whether they are at risk or not, because at the end of the day, fat is the culprit. The second important thing to know is that not everybody who looks fat has got fatty liver disease, and not everybody who's lean does not have fat in the liver. So again, this is something which actually confuses even us clinicians.
So liver being the superhero, and do you think alcohol is the only villain it has to fight with, or what are the other agents which could secretly be damaging the liver?
So alcohol and fat, they produce a kind of a similar injury. Of course, as clinicians, we can distinguish between the two. Oftentimes, the history is extremely important. You should always interrogate these subjects in the presence of a family member or their spouse or next of kin, so that no history is being hidden from the clinician. And then there are also some tests that we can run to see whether somebody has been surreptitiously consuming alcohol and not accepting the same in the office. So there are ways of circumventing this problem.
So the bottom line is high calorie food is equally dangerous as alcohol.
Absolutely. And someone who's been taking alcohol and also has got fat because of metabolic aberrations is likely to have a twin injury. So there will be injury due to alcohol and there will be injury because of the excess caloric intake.
So for social drinkers, is there any safe way to enjoy their alcohol without harming the liver? I'm sure this is a very common popular question.
For all practical purposes, if someone comes and asks us that, is there any amount of alcohol that is considered safe? The answer is no. Because when somebody is putting that question to you, there are two aspects to it. A, you do not know what their baseline level of health is, health and well-being, I should say. And two, this is one of those substances which we know from experience you can very easily lose control to. So for these two reasons, even if a doctor is pushed to a corner to answer this question, it should always be an emphatic no. So there is no safe limit to alcohol consumption.
So when I ask you, fatty liver is reversible, is it a myth or a fact?
It is a fact that you can reverse fatty liver, but then it is like many things in medicine, not the whole truth. So it all depends on what stage you have diagnosed somebody to be having a fatty liver.
So I guess liver doesn't just need perfection, but it needs consistency with some smart choices. So with this, is there any message that you would like to share with our viewers out there as far as liver health is concerned?
So I think the most important message is to know that there is a problem. So we should know that there is someone who's got probably fat in the liver. It just takes an ultrasound, a very, very easily available test to know that. And then risk profiling. So diabetes, obesity, family history of liver disease, family history of diabetes, family history of cardiovascular disease. So these are the important determinants that will help me decide whether somebody would just need a lifestyle intervention or somebody is at risk and would need more attention from me and maybe consideration for a pharmacotherapy or drug therapy. And the second important thing is never to stigmatize these subjects who are ever so commonly coming to your offices nowadays. So you should never ever start on that wrong note saying that the given subject made the wrong choices or the parents did not give enough attention in the formative years, and that is why that subject is looking the way he is looking or is weighing the amount that he weighs. So these are the very important messages that must go out to the public. There is treatment available, there is help available. We have to be more guarded in what to expect from any intervention that we make, and at the end of the day we must understand that it is the physiology that is deciding this kind of a patient phenotype and not purely the choices that a given individual is making.
So thank you, doctor. It was wonderful interacting with you, and thank you for such an engaging and enriching episode.
Thank you. My pleasure.